Hi, I'm Dr. Blanche Grube, and I'd like to speak with you today about a specific section of children's dentistry. What to do when the child has a very deep cavity in an important tooth, which is usually one of the molars in the back. Child has a deep cavity in a molar that is going to stay in their mouth probably for another 3 to 5 years. What do you do in a situation like that? Most conventional dental offices would tell the parents that they must have something called a pulpotomy and a stainless steel crown. Well, it is very, very amusing and sometimes infuriating that they use terms that really don't mean what they say. Yes, a pulpotomy is the removal of the pulp of the tooth, but in fact, it's a partial root canal. I think if the dentist said to the parent, "We're going to do a partial root canal on your 10-year-old," I think most parents would say, "What? A root canal on a 10-year-old? I think not." Or if they said to you, "We're going to do a pulpotomy and then we're going to put a nickel crown on top of the tooth." Wait a minute, nickel? There are actually some parents that know that nickel is a carcinogenic. They might actually object and say, "No, I don't think so. Not on my 10-year-old." So today I want to talk about pulpotomy stainless steel crowns as opposed to treating the tooth with biomimetic dentistry. Bio what? Biomimetic dentistry, bio meaning life, mimetic, mimicking what's naturally there. In biomimetic dentistry, it's not necessary to remove all of the decay and make sure that last little bit comes out, because if you do take that last little bit out, you're going to wind up inside the pulp or inside the nerve of the tooth. In biomimetic dentistry, we clean out the decay around the outside of the pulp. Do that very thoroughly, scoop out some of the decay, but we don't go hog wild removing all of the decay. Then the tooth is treated with ozone gas. Why ozone gas? Well, because ozone gas kills bacteria, viruses, yeast, fungi, mold, you name it. It sterilizes that tooth. So if there's any more microorganisms in the tooth, they're going to be killed. Once that's done, then a composite filling can be placed right on top of that area that might be a little soft in the middle, but pretty firm around the outside. If I had a child who was 8, 9, 10 years old that had a deep cavity in one of their molars, one of their baby molars, that's supposed to stay there till they're 11 or 12 years old, I'd rather take my chances with a biomimetic composite filling than doing a pulpotomy and doing a stainless steel nickel crown. Let's call it what it is. It's a root canal and a nickel crown on top of that. And everybody knows that nickel is a carcinogenic and not good for anybody. So, that's my opinion. I've been told I'm highly opinionated, but you are the educated consumer, and when it comes to children's dentistry, you are the one who makes the choices and the decisions for your child. So, you have two choices. You can either go with a pulpotomy and nickel crown, or you can go with biomimetic dentistry and put in a composite filling. Either way, the child is going to have some dentistry done in order to keep that tooth there without them having a toothache until the time that they're 11 or 12 years old. So that's my conversation today about pulpotomies and stainless steel crowns. As you can see, I'm not a lover of either procedure. I think there are alternatives. The patients and the patient's parents just need to be given the information for those alternatives. Thank you for listening, and please come back again to our website for more information about today's dentistry.